This morning we are talking tuberculosis. We're talking tuberculosis. Doc, it's part of the 6 killer diseases.
Yeah.
Charlie, those 6, no. Who bring them? Why
bring them as come? Or who does part of it together?
Who choose those 6? No, we be kidding. They say 6 killer.
Like the other ones, they know they kill.
The other ones they kill 6 killer childhood diseases. Can you name them?
Tuberculosis.
Yes.
Yeah. 1, 2, 3, 4, 5. I've said one.
Then Debbie go come talk the last one.
Which one? Could you name one?
The 6 killer diseases.
Yeah.
I don't know if measles is part.
Measles is part. Go on.
Tuberculosis
is part. You mentioned what?
Tuberculosis.
Malaria is part.
No. Diphtheria.
Diphtheria. Yeah.
Okay.
That's the.
Which other one again?
You have pertussis.
Hey, Doc, I beg you, stop that.
Whooping cough. What you call whooping cough?
Doc, stop that.
Then you know we laugh.
Doc, we all dig on where you want to go.
No, it's pertussis. Whooping cough.
But pertussis.
Yeah, it's called pertussis.
Pertussis.
Yeah. Pertussis.
Oh, pertussis.
Yeah. Then that's whooping cough.
Uh-huh.
Then you have tetanus.
Okay.
Right. That's one everybody knows that one.
Yeah.
Then the last one is polio.
Polio, pertussis, tetanus, diphtheria, tuberculosis,
measles,
and measles. Yeah. Yes.
I thought chew and pour was one of them.
These we are narrowing down to tuberculosis, though.
Right.
But is there a reason why these 6 were highlighted as ones that we should take care of? Was it a territorial conversation?
Yes,
because
exactly. It's where we are. Number one, our environment is one. The first one is our environment. being born here is part.
Oh, Charlie!
Because I'm sure if you go to US, this is not. Some of them are not part.
They don't born yourself. This is the way.
The 6th day they did the town before you come.
Yes. So
either
you protect yourself before you come. When you come out.
I beg you, it be Africa or be Ghana.
Africa.
So they no born you say if they're born for Africa, these 6 killer diseases they way to you.
And no, another thing too is that the reason why it's vaccine preventable. Immunization helps.
Okay.
So it's vaccine preventable. So you take a vaccine and then you're okay.
The reason I'm asking is there something synonymous to the 6 of them? Is there something?
It's here. It's environment.
Are they transferable? Are they?
I think the thing is why them
communicable.
Communicable? Right? Are they like is this in the air?
I want to know why them.
Why those 6 guys?
Because other things they kill.
So if you take polio, right? Its complications are disability and death if your breathing muscles get paralyzed by the polio. Right, that's polio alone. Then if you go to tetanus,
wait, and polio is it something that like maybe from mother to child or?
Polio
I know we didn't plan that, but I just want to.
Polio is from a virus.
Okay,
it's from a virus, so it's an environment also. So poliomyelitis, yes. So it's a polio virus, so that's what causes it. Then if you go to tetanus, you have Clostridium tetani. It's a bacteria which then enters your body from metals and all these things. So tetanus enters you through cuts or wounds.
Yes,
right?
yes.
And with children, they are very playful and like they play with a lot of things. So there too, the same thing: muscle stiffness, jaw locking, painful muscle spasm, and complication is breathing difficulty, which leads to death. So polio, breathing difficulty, death. Tetanus, breathing difficulty, death. Then pertussis, pneumonia, brain damage, death. Death in infants. So, and then you go to diphtheria. You have sore throat, you have fever, swollen neck. The complication is breathing difficulties again, heart failure, death, paralysis.
Hey, Charlie, they no born yourself. These people.
So if you look at it, then you go to TB. TB to the same. So it's like all of them are circling around your lungs, your breathing, your ability to breathe, and your ability to circulate blood.
It's
and guess what? When a child is born,
yeah,
those capacities are not really. They don't have
developed
immune system yet.
Yeah, so
They are susceptible.
They are very susceptible to these things. That's why we advise for the breastfeeding, because the breastfeeding contains antibodies that help shield the child.
Doc, in your own opinion, out of these 6, right, which of them is deadly?
TB.
Joshua.
See, okay.
I call you. Yeah, Kojo.
It's okay.
Is that? Now they won't call you. I think they call you Joshua. Sorry.
It's okay.
Yeah. So why does TB stand out amongst these 6 as the deadliest?
Because TB is a bacteria too, and TB goes straight to your lungs and disrupts your ability to absorb oxygen.
Is it airborne?
It's airborne. So
Wow.
if I cough and you have TB, you get it. Funny enough, there's another form of TB called latent TB. You can have it and not show any signs and symptoms. So your body has been able to suppress it, right? Whereas you have the one that causes the problems where you have your lung capacity is reduced, your ability to absorb oxygen is reduced, and then it starts causing opacification. It starts causing when we get to, I'll show an X-ray of a normal lung, and I'll show you one with TB, and you can see this white nodular patches in the lungs.
So tuberculosis is caused by
It's mycobacterium tuberculosis.
Okay.
So it's a bacteria.
It's airborne.
It's airborne. So its primary infection site is your lungs, primarily. But it can go as part as extrapulmonary, like your spine, your brain, and your kidneys can get it.
Okay. So are they types? Are they grades? Are they stages?
Yes. So there's stages to the infection.
Okay.
Right. You ask the question, why is TB deadly? It's not really deadly, but lack of treatment
Makes it.
So when we move on, I'll show an X-ray of somebody who had TB 27 years ago, and they took an X-ray 27 years after, and you could see that still the damage that TB did is still there. A lot of TB has been there for a millennia. It's been there in the beginning. It was killing a lot of people because there was no
I think
treatment.
it was very prevalent in India.
India, yes,
Yeah.
because
So the bacteria,
Yeah.
So-
high population.
so if you look at the 10 causes of death in the world according to WHO rankings, right, TB is in there.
Hey. Listen, we all talking.
And it doesn't get a lot of exposure. It doesn't get talked about unless the World TB Day and we come and we talk about it and then it passes on.
Is it because people underrate it?
Exactly.
Because we
Yes,
we-
it's also
brief of-
prevalent mostly in third world countries.
Exactly. Here.
And you don't
Environment.
make the headlines because you have made your place dirty. So you are dealing with the consequence of your own actions.
Also, people are investing in cancer research and they've
They are
moved
still
past.
shouting
they've
at you
moved
to wash
past-
your hand.
Yes, you are still shouting. Wash your hands. Eat hot food. Don't buy food near gutters. Don't.
Oh, no, what
like-
I'm saying. I just finished this. Dog,
no,
stop
but
that.
you know they talk about all these things.
Look what I'm saying. I just finished.
You buy cocoa 80%, 20%, other things.
Because we've always been saying this on every health Tuesday. We talk about early diagnosis is what prevents a lot of diseases, like from getting to death. TB is one of them. So when we talk about, if I talk about the symptoms or signs and symptoms of like TB, like why would somebody ever talk about that? Like, yeah, what do you watch out for?
Yes.
Somebody who is coughing, prolonged coughing for like 2 to 3 days, it's not stopping. Then the person comes and tells you that another one is the person's coughing up blood. That's an advanced case. As you said, advanced TB, you start coughing up blood. Then you go on to chest pain, weight loss. Now, weight loss is a very clinical it's a very big thing for doctors, because when somebody comes with weight loss, we ask you, what was your weight? And you say, I was maybe 70 kg. And when we check, you're about 50 something. That's unexplained weight loss. Nobody can get from that point to this point without something drastic happening. So it can either be a malignancy like a cancer that's causing it, or TB.
Doc, sorry to cut you, but is it in that order? Coughing out blood.
Yes. So it starts with the coughing. Yeah.
They cough out blood.
So
Are you
the coughing is so bad.
No, it's
the
like-
coughing is so bad. The coughing.
If you
TB
start
is
the
so,
cough out blood, no, that should be a sign to go to the hospital.
exactly.
So,
That's when
yes.
you go to advanced stage. Oh.
But people would be coughing blood and still not go to the hospital.
Bro, that's why it's a third world problem, bro.
Oh, crazy.
How many people have you heard coughing? Like in the morning, you hear the person coughing. Then you go and come in the evening, the person's coughing. Like he's
Still
getting
coughing.
worse. And the person has done nothing about it. He goes to from I'm taking ginger, I'm taking all these things. Day 2, still.
Still the cough.
Like, Chama, you know, go hospital. So, you go. Then we are on it. Day 3. Then you are getting to advanced stage. Now, you're having breathing difficulties.
Now, what a shock.
And now, because you are coughing, it's difficult for you to eat. Because the same pathway.
Yeah.
So you put the food in there, you have to pause, let the cough come in there.
Yeah.
No.
Okay, so after the coughing blood, what's next? As you said.
Weight loss.
Okay,
Chest
that's when.
then
could
fever,
you-
then night sweats and fatigue.
Okay.
I'm good, OJ.
No, I'm just checking.
So you have like fever, your night sweats and fatigue. The person, I'm really weak. Like the least thing, the person is really like tired lying down.
Are they like risk factors?
Yeah, there are risk factors for TB. Environment.
They put quasi.
So the risk factors are
For real.
inhalation, environments that are really dusty or prevalent for this TB, or coming in contact with somebody with TB. So people at risk are usually us as doctors.
Okay,
health
Doc, you know
practitioners.
they say HIV, for example, it can't live outside the body or something. I don't know.
Yeah, for
a certain amount of time. What about this bacterial virus that causes TB? Does it can
Exactly.
it
It
live
also has a time.
as a time frame?
Yeah, has a time frame.
Because he said the Pokwase, for example, we take
Why
a
Pokwase? I don't know.
no the road condition there. There's a lot of dust, and we take these
The one
things
that's
for
being
granted.
made. Oh,
You
okay.
know, we
the
take it
new
for
one.
granted, but it's a lot of bacteria that is floating and that's in the air, and we just keep breathing in and out.
Yes. So what you're going to get is a high risk environment for somebody who has pulmonary issues like asthma. People with
Yeah.
asthma, right? Even people with anxiety can have issues in places like that. Or people are. You see, when it gets dusty, some people feel like they can't breathe. That's psychological. Like, person sees a lot of dust and person freaks out. So that's one other thing. And people who have what's that thing? That sickness, that motion sickness,
Yeah.
right? That's another one of them. Now, the greatest thing about TB is its diagnosis. So we use your saliva, your sputum, to test it. Then, or we use
Use your what?
Sputum.
Ah.
Sputum.
sputum,
Oh, I heard something else. Sorry.
not scrotum. One.
Yeah, I don't. For real, that's what I
Yeah.
said. That's what I heard. And I'm sure the other listeners and
So we
viewers
have-
also heard. Yeah, they used to go to the check.
What are we going to do with you?
Charlie, I think I don't know. Me say I'm shocked.
Then you have a rapid molecular test, which is called a gene expert test. Then you have a chest X-ray. You have a tuberculosis skin test, which we don't. It's called Mount 2 test. Then you have blood tests that they can do.
Okay.
But
Are
most
these
of the
alternative
ways to
tests?
get it, yeah. So
Or is the roster of
cheapest
what you
one
have to
is
go
the no is the
But-
cheapest one, or the gold standard is your gene expert, right? But due to cost and other, maybe where you find yourself in X-ray, you might use X-ray to also find out what's happening in your lungs.
The pause right there. Let me just digress small. I beg you, please, guys. I don't mean anything, but I'm just asking that because he mentioned the scrotum, the scrotal sac. No. Because we mentioned that. I'm just digressing. I'll come back.
Because you
I'll
heard
come
that,
back.
though. Not because you. Yes.
because I heard that. Charlie, you know that I've seen that skin is really tough, right?
The scrotal sac.
Yeah. It's very tough.
Yes. Not really.
No, it can be turgid, but it's not tough.
Yeah, it reacts to environmental
Weather
temperatures,
yes.
weather conditions.
Weather conditions.
So it can constrict.
You guys,
to keep
you
warm.
have balls to be discussing this on radio.
Okay. No, I just want it just crossed my mind. That's for knowledge purposes. All right.
So, but what
Yeah,
you're
grab
saying,
later.
I was wondering when I was going to ask about that skin type. Like, it's only you is fine, Charlie. Let me just go back to the conversation here.
No, that skin type. No,
But we want to know why you wanted to know about.
It's elastic. It has elasticity. Yeah.
Yeah.
Oh, why are you laughing? But he asked the question. You don't want to talk about balls again.
It is not found anywhere, any other part of the skin, body, but just that place.
Yeah.
Yeah. No, I just wanted to just get clarity on
Yeah,
that.
the special skin.
Special skin. Yeah.
Yes.
Doctor, so let's go back
so
to
another
tuberculosis.
thing
Yeah.
with TB, anybody with TB, we test you also for HIV,
Any reason?
because HIV gives you a HIV co-infection. So when you have HIV, your immune system is compromised, which
Okay.
makes you very susceptible
Yeah.
to TB. So when somebody presents with TB, that's the first thing you check. Maybe the person is undiagnosed. You ask the person if we can check for this to see if you are immunocompromised. That's what's causing the problem. So you solve that and not just treat the TB alone, as a standalone. And the thing is that right now WHO is hoping that by 2035 we've cleared TB all over the
Completely
world.
eradicated. Yeah.
That one I don't know how.
Please, so the name tuberculosis, is there, I mean, for the English scholars amongst us, is there any breakdown to it to understand its, I know, yeah, I was just going to go to co-pilot. I don't know, because of the tuber that is in there, and I want to, but it is, if this is how it spreads, then it means that we are all at risk at any point in time.
Yes, we are.
You know, and then that takes me back to the vaccine that is given at childhood. That I don't know whether, so that's how it works. It stays throughout in our body all through till.
Yeah, it's a lifetime treatment, but you can go for booster shots. If you feel like you're in an environment where you'll be exposed, you go for booster shots. But the reason why we give it earlier on is for your it encourages your body to build the immunity against it. So as you said, you saw in the animation, if you're not able to, your body's not able to fight that virus, then bacteria starts to take over. And it can't multiply on its own. It needs your system of defense to multiply, just like HIV does.
Yeah.
So your capacity to replicate your defense cells, which is the T cells, right, is the same system that they need to replicate themselves. So if the infection starts, you send people to go and fight it. Now your soldiers go and their guns are taken from them and their weapons are taken from them, and they start using it against yourself.
Can this ever be dormant?
It can be dormant.
So you can
have it
have
dormant.
it,
Yeah, you can have it and be
it will
dormant. Yeah. The treatment for TB takes about 6 months.
Oh, wow.
So what
So it
if
means if you don't take your drugs, if you don't take the drugs, you are only going to make it the stronger.
Yeah, because you are making them more resistant to it. Yes, sorry.
I'm asking that because let's say there's somebody who has it, doesn't know, and it is dormant. Can this be a lifetime thing, or there's going to be a point where it will definitely come out?
So you should always know that as soon as you are immunocompromised, let's say you are highly stressed, you got some malaria, you got an infection that is causing your immune system to sort of be on hyperdrive and it's weakening your immune system. If that TB is latent and sitting somewhere, that's when it will activate itself.
Okay.
It's just an opportunistic
So
bacterial infection.
should we be checking this thing randomly?
Yeah, you can. You can walk into a facility and get
So you won't check
TB.
for
Yeah,
TB.
you just TB
Crazy.
alone and walk out.
Okay. You don't even.
And how is this? Okay,
Especially if you
lab
feel
test,
like
right?
you've been around somebody who's coughing a lot, right? You
Mhm.
can just get yourself tested just to be. But it will be best if you bring up, because TB. When I diagnose you or any health practitioner diagnose for TB, we send an alert.
So anyone around you.
Yeah, we send an alert even in the facility. We are supposed to report it to the
Look,
public health people that
yeah.
we found a case of TB here, right? And then we have to do a contact tracing. Those type of contact tracing for that person.
So, Doc, you're in an
where do you
office.
live? Like, where do you work? We go
Because
there.
so see what you just said, right? What he's thinking about ask
Yeah.
about. We hear malaria more often than like you 6 months or you see malaria 6 months or malaria. We there like malaria.
If it's not malaria, it's flu.
It's flu, yeah. In general, this thing we all for pass through. I understand, but these cases of tuberculosis, how prevalent are they, and how common are they in our daily Ghanaian cycle or in your line of work?
Yeah, they are not common because people are not reporting it.
Okay, but it is there.
Some also go undiagnosed or misdiagnosed as something else, because the person might be treated for just the cough and then the person's fine, and then we move on from it.
Cough syrup.
A cough syrup, like and those times we don't even diagnose it. Usually the pharmacist they go, I'm coughing, and then they give them something for it, and it suits the problem, and game over. So that person goes into maybe hibernation. If the person thinks it's fine, right?
Okay.
Then another time the person starts coughing again, and then that time spread to other people.
Okay.
Those people also don't report it. So though it should have been something that should be reported, like we should have a lot of cases of it, we are not getting because it's not reported on time, or not reported more of it.
So COVID and TB
In the same group, then it's the same family, respiratory conditions.
So what makes COVID a pandemic and TB not a
Because
pandemic then?
COVID has a shot. Like it starts from point A, and then symptoms, then it starts to break you down and destroy you, like cells, and then your
Whereas
lungs.
TB takes a longer time.
TB can go because your immune system can fight against it because you've taken a vaccine against it. So because COVID doesn't have a vaccine from childhood, it never had.
Yeah.
So COVID was jumping on people whose immune system was compromised. If it comes, it knocks on your door, you open, it's in. If it knocks on your door, you're able to stand behind your door and hold it down.
I know.
and
I
it
think
moves
you
on.
mentioned that before, but did they know if you get COVID? I had it twice, Charlie. Like
Twice?
yeah, bro,
Oh.
twice.
Nope. I stayed in my house.
As you were told.
Twice.
As you were told to do.
I did not go out.
The first, I mean, I think I said it that I started feeling. So one morning I woke up, I was going to work because we were still going on TV, and doing our work, and I was going to work, and I started feeling some way. But early on, we had done tests because one guy had been diagnosed of the
So
virus.
what was it quarantine?
And yeah, so when it happened, they immediately made us all do tests.
Okay.
When they found out the guy was diagnosed, they made us all do tests. And then the following day, when I was on my way, I started feeling sick. It was so quick. So that's how I'm saying that I think
So you couldn't taste
shared.
food? Like,
Bro,
you
I couldn't smell and taste food, bro. Like it was so sad.
I couldn't smell and taste food unless I took my nose mask off. I was going.
I'm proud of you, bro. Do you know something?
That's
I'm proud
it.
of
That's
you.
it.
It was that bad.
Listen, I went
You
out.
didn't get it.
I went out every day.
Initially,
I went out every day looking like
Yeah.
I was
My
taking
mind,
ninja
Yeah, I'm
class.
sure I got COVID at some point, but I probably just walked the talk.
so
Yeah, I think a lot of people had that.
Yeah, no, like, for real, like,
people felt
my
ill.
joints went things, and then
The-
I
the-
was
the-
at
the-
home,
the-
and I was
the
just
bits-
like, it's just me.
the
and
bits
I'm
where you
like,
can't taste it's so annoying. It's not sad. It's not painful. It's just annoying.
You see how life
You
can
dey
be. The
see-
things we take for granted,
Charlie,
right?
you dey
They don't
see,
kill your
you dey
appetite,
see,
though.
bro. Listen, I feel chop pepper. I feel chop pepper. I don't dey feel anything. Honestly, I literally
It's a
ate pepper,
superpower. It's a superpower.
and I could only feel the sting like it dey far. It would take time before I go feel say
that's
something dey
weird,
bend.
Nah, I'm wrong.
But bro, it was really hot though. Like, but and the smell too, Charlie. You can't smell jack. Like you go feel spray perfume, and you just spray water for your skin.
Crazy.
Some way.
It's
Yeah.
the the two things we take out of your life.
Yeah.
You see,
For granted.
you take a lot of things for granted, like
Yeah.
smell.
And then
This
when you
area, right?
mention-
This area,
You
take
see
sight out.
Yeah.
Take your smell out and
When
take
you
taste out.
mentioned the weakness, Charlie, like if you walk from here to the door and bro, then you tire.
You feel like you've been you jog to the north.
You tire
No.
like you tire. It was really
And you are
annoying.
breathing difficulties, like you are really.
Yeah. So I just went back home that day. I remember my brother money, went back home, and then the neem treatments, and then the Zitromax
Yeah.
3-in-1.
but the
Zitromax
neem,
3-in-1. They
yeah.
give you some dosage. Be take them 3 days, something be fire, back,
Brother,
and then you
yeah,
will smell. You hear neem tree
But the
burning.
name there that time. See, listen, like the name
Shortage of-
name near me the year name na nka, oh,
One
name.
number, one number.
Bars, my nigga.
Jai, jai.
Only name.
Yeah, who name?
Yeah, with Chichua maintains,
Jay,
you know.
I
But I was about to get too
I
far.
was bathing with like neem. I was drinking like at a point. If you substitute them for water with water, you never go drink.
Yeah. So like for the next I think 12 to
You see?
15 days or so,
Yeah.
you know,
I love God. Nobody wants to meet their maker.
I know.
Yeah.
12 to
You didn't want to
15 days,
go
I
and
was
meet God.
home.
God is God.
No,
quarantined.
God said that the fear of God is the beginning
Oh,
of Nim Dear.
Yeah.
Okay.
Nim Dear.
It's a very uncomfortable. So I can imagine that of TB as well. Probably a very uncomfortable moment
But he
to
said
have.
something.
But
Okay.
yeah. No, finish it. Finish it.
Alerting. So you're in a space, you're in an office space, you have TV. Where is the alert going? Because you said your fellow.
Yeah, no, you when it's on the what's that word? Honest.
The
onus is on
Of the
Yeah,
person.
The honest lies on that person and people around you to tell the person, please get help. It's like the time we deal with COVID. Do you remember, I was at the airport. I remember I was coming to Ghana during the COVID period. I was on the airport and then we're in a queue for, like it was quiet. The airport was like half empty. I think we were like last flight to come to Ghana or something, and it was quiet. Then somebody just coughed.
Hey,
Crazy.
see,
last
see,
cough
like it's
last
just sort of like
yeah.
Last cough standing.
and the person was just standing there. And then before we realized the person was in water, so I think he was drinking water and then it went the wrong way. But
Okay.
even still, Charlie, in the
Charlie,
flight,
but- Charlie, but the
people were
COVID
looking at the
time-
person.
Charlie,
I
but
want to
the
get
COVID
something clear.
Yeah.
You see, I'm trying to say that.
This person
You
goes
see
to the
that
hospital.
reaction we did when COVID came? That reaction we had,
Yeah.
that consciousness to, if you please get help. Like we're snitching on people. People were snitching on people. We were calling
Okay.
Charlie, my neighbor, the way he's coughing.
Okay.
Right?
Wow.
We should use that same thing to help people who are hypertensive, diabetic. Like, if you see somebody being dizzy and walking, I feel like the person is feeling weak, tell the person, get help. Or call for help for the person.
But no, the thing is, not everyone can identify or.
Isn't that why we are doing all this every Tuesday?
Yeah, but so is this enough?
Doc is like
The virus.
Okay,
The virus.
Knock a blame. Knock right there, blame.
No, so you go to the hospital.
Knock the suffer from Tuberculosis.
Doc, person A goes to the hospital.
Right.
Person A has TB.
Right.
It is on them to come to the office and say, I have TB.
No.
That's
No.
what I'm trying to get
You-
to.
you-
Because
you
you said
call-
there's an
no,
alert.
you tell us.
The onus, no. The onus.
When we diagnose that it's positive for TB, right? The results come that it's positive for TB. We go ahead and start taking information from you concerning where you've been, so we know who to call. That's why it's called contact
So
tracing.
unless the person lies.
Or that person
Oh,
lies.
so-
Like in COVID, what happened where a guy and a girl found themselves in the same zone. They were being kept somewhere because she had COVID, he had COVID, so they have been in the same facility, and the family members of both parties were also in the same facility because contact tracing. You know, And then the ex was also there in the same place. So now one guy.
So you
like,
go fit call Jay Foley. Say Charlie, this person from
Yes.
the office get.
yes. So we call. No, we don't want to raise that. So,
Yeah, that's how I
so
want
you,
us to
you
get
send
clear.
somebody.
Why
you
my,
send-
why my dog can say story? It's also X9 again.
you send somebody. Usually, we send somebody to come in to the office
Okay.
and maybe meet the HR.
I've
whoever.
never heard
That's
this
if the
before.
person doesn't lie.
That's where, and a lot of patients lie.
I've
And
never
because
heard
people are
this
afraid.
before.
If
Where do you work?
patients don't lie, doctors won't be studying clinical psychology.
Yeah.
Wow. But who's going to say it though?
I
Like,
have
who's
this.
going to actually say
Yeah, I
it?
have
How
of
will
this.
you
You know
do
how
it?
it starts. Oh, doc, I want to talk about something. My friend B, you've lied. As soon as you start like that, we know that is you.
Oh, but sometimes it could be a friend.
What are you doing in the hospital for? Bring them.
I'm
Let
shy.
the friend is shy. You're getting on behalf of the person.
Well, I've never heard this before. You know? That's why I wanted to like. Okay. Thank you for that.
So, so when let's talk about just the treatment, right? When I'm talking about treatment, I also want to talk about the types of TB we have. We have drug-resistant TB, where your medications. So we have first-line drugs that we use for TB. They fail. Then we need to go to the second line. So you have like your first-line drugs like isoniazid, rifampicin, you have pyrazinamide, you have ethambutol. Now, some of these medications I'm talking about are also used for treating HIV.
Okay.
You get it?
Yeah.
Dog,
So-
it's TB is.
TB is not AIDS, but they come together.
They come together.
And the treatment is for
It's a
6
package
months.
deal.
The uncomplicated cases of TB, they are treated for 6 months. Treatment like 6 months.
The
continuous.
uncomplicated.
Uncomplicated, yes. The other ones you might need hospitalization.
Get
for-
on Ujinem. First 9.
So all this we're talking about is that if you're HIV positive, right, and you're not on treatment, it's important that you get treatment because then you're at risk of TB, right? If you are TB, you have TB, and then you live with family or you live in like places where it's crowded and all these places because it's a pneumonia-like symptom. So you need to get treatment, just not for yourself, but also those at risk around you.
But though, just to be clear too, not everybody cough because there are some people listening to this are going to take at face value. Hey, if I hear somebody they cough, you get TB.
If somebody,
But
is
not
co- if-
everybody
That's why
coughing has
we give
TB.
a duration, right? 2 to 3 days.
Still coughing.
Yes.
Okay.
We talk about we saw the blood,
Yes.
fatigue, chest pain. We are taking all the so you are ticking boxes and like, oh nah. If you're getting 3 out of like 6, bro.
There's a problem. Okay. Because right now, I say somebody will hear this thing. Brother man cough. It's
No,
gonna
but
be
some cops are there. They are very like
I think we need to discuss coughing on our next this thing so that we can understand that some cough.
Get
we have a
cough,
cough
get
where
cough.
we get cough where we get cough
During COVID,
because
people were afraid. People would hold their breath and try not to cough. Because the stigma was that high. Why is the stigma not high for TB?
It was a death rate.
It's low.
Like if you get it now, there's treatment
Are
for
there
it.
things with significantly higher
Mortality.
Yes.
Africa here.
Yeah.
Oh yeah, we have
problems.
Trotro.
yes.
Ajinjin,
We have-
bank account.
And we have the uninfectious disease like hypertension. We talked about those things: chronic disease, diabetes,
Blood
hypertension,
pressure.
Those are
blood
those
pressure.
Momo loan.
pulmonary.
yeah, they're pulmonary in nature. So it's both pulmonary and vascular in nature.
Okay.
Because when you have hypertension, be clogged blood vessels that lead into that, then stroke, then heart failure, then
So it's not an emergency. It's a critical disease.
it's an emergency. It's something that we are as part of our training. We are supposed to alert. There are some diseases on the list that if we find someone on it, like monkeypox, as soon as you see it, you're supposed to report it. If you see TB, you're supposed to report
Is that because it has a high risk factor of blowing up into something
Exactly.
else? Or is it because it is doing something bad now?
No, it's the high risk of it becoming.
Sorry, I'm doing PR for TB.
Yeah, so it's high risk is the fact that it can start from one and just blow up.
Yeah.
And become uncontrollable.
Yes,
Please
uncontrollable.
hold on right there for me. But we'll be showing the picture that you said of the two
X-ray. Okay, very
X-rays. Let's get that ready. But before that, it's also time to get rewarded as the next big sports betting influencer, KTC Betway. So place your bets, share codes with your friends, fans, and followers. Now, if they place bets using your code, you earn 4% of their wager. It doesn't matter if it's a win or it's a loss. Once they bet, you earn your cash. And the more people that bet with your code, that means the more money you're going to make. Start betting, sharing, and winning with Betting Influencer. It's exclusive to Betway. Terms and conditions apply. Regular regulated by the Gaming Commission of Ghana. Bet the responsible way, Betway gets way more.
You see what I thought? Doc, you see what I thought?
Why are you going to?
Please let's watch that. Let's put the picture up.
Why sit down?
Doc, you see what I thought? I do.
Okay, so that's
tuberculosis 27 years ago. The first thing you should note is the loss of lung volumes bilaterally. The lungs look smaller. Both hyla are displaced upward. Mediastinal contours are very different from what.
So on the left
Yes.
of our screen, I don't know how somebody's screen is, but on the left of our screen, we have somebody who has 27 years of TB.
Whoa.
Right? And on the right is a normal lung on X-ray. So you look at, you see on the right one, you see there's a shape that's been drawn.
They see all the same.
No, the outline. You see they've drawn an outline of a white outline. That's your heart. That's your heart.
Hey.
That's the shape of your heart.
Doc, wait. On the right side,
On the right,
where there's text on the screen that says normal cardio.
Yeah, that one.
That's a normal.
You see the heart silhouette.
I know the heart is big.
So it comes from like the blood vessels down, and you see the heart. It moves it's towards your left. You see, it's more the apex towards the left.
You mean this thing?
Yes.
So the white outline there is your heart.
Heart, yes,
And this guy get big heart.
So and look at the right
Very
side.
kind.
You
Yes.
see that you can't really tell the outline.
Yes.
It's wider.
Yeah, it looks concave.
So
yeah.
that's another sign that we used to tell. Now you see the right helium, left helium. Look at the right helium, left helium. Look at up. One is lower.
Yeah, you guys they try your doctors because honestly, they see all that they see be cool body.
No, so if you see like dark, you see where the dark areas are.
Yeah. Yeah.
That's air filled. If it's coming dark, you see. This one is darker. You have to pass. It has white. Just white patches in there, but the right side doesn't have it.
Clearly, these are the things that you doctors receive, and then we don't understand.
Yeah, you put it on the light and look at it.
But we don't understand. But I mean, clearly, there's a difference between the two.
Yeah, the
bodies.
two. You can see.
You can
clearly.
see. Yes.
That there's something wrong.
In the upper part of the infected one, you can tell that there's a bit of a white patch getting closer to the
clavicle.
The
clavicle.
Ostracles. Getting closer to ostracles. You can see that at the top part of the ostracles is the problem there?
Clavicle.
Yeah, ostracles. So yes, we can tell from the two. So as it looks like the one on the left has had it for a very long time.
period. So he's somebody who has healed.
Has healed, but still.
Yeah, you can still see that there's still damage was done to the lungs.
Yes. Yeah.
So this person could be fine. The left one, you could be fine and everything, but now he's going to have reduced, like a lot of things that strenuous activity and lung function will be a bit reduced, right?
Well,
now when you went to you talk about types, right? You have the latent type and you have the active type. The active type means multiplying. The latent one is what most people have, where there's no signs and symptoms. It's in your system, but it's not contagious and no symptoms.
Okay, all right. Doc, our time is up. We have to be wrapping it up now.
Doc, please, would you want to send out an alert? J fully has come. I beg you.
But
we should start tracing it.
Yeah, contact tracing.
But then you are part. You and I are part of the contact tracing now.
Anyway, Kojo, it's fine. Our time is up. We have to go, but I would really want us to look at the other killer diseases later on as well.
So we're going to the list.
Yeah, we'll check them out.
You better add malaria to it.
Yeah, because it looks like it's just become.
Oh, right now there's a vaccine. Thanks be to God, research and everything. Right now we have a vaccine for malaria for children.
But what are the side effects of the vaccine?
There's no side effects.
Yeah.
Doc, everything comes with a side effect.
Doc, did you take a shot as well for the COVID? Did you take a shot as well, or you were?
He's frozen.
I guess he'll take a shot to that.
We are live. I paused.
Purge you. Doesn't have to purge himself on the stand.
Please the fifth.
Yeah.
I plead the fifth.
I think we're supposed to go for 2 or 3 or so, right?
Yeah.
So you took all 3.
I got it all. I got it all. No, but if
I did one
like close.
but if where we are working, you don't take your shots. Yeah. Daily, we expose daily. Consulting, we don't know who is coming. Someone enters your consulting, starts coughing. You can't tell whether it's TB.
Yeah.
So as long as you even diagnose the person of TB, you have to get shots.
Doctors they suffer.
So everything they come to the office there. Everything some.
Yeah, our time is up. We are
Where
back
the
here
difference
again.
us and a market woman?
Yes. Our time is up. We have
Everybody's
to get going
exposed.
now. We're back here same time tomorrow again, Wednesday edition of Culture Daily. Gentlemen, thank you very much. It's been a good one. We'll also look at this skin types. Doc, I'm raising because the last time we discussed skin types, you didn't mention that skin type and why that skin type is such, and does it contain the same epidemics and all those things. We'll definitely come to that conversation. Yes, Jason.
Shout out to my mama. I love you.
Yeah, no, yeah.
So today's the next
Yeah.
day.
No.
We're back here.
You cannot redeem yourself.
I love you, mama.